Okay, another question that we've had is, I'm struggling with thin lining for my frozen embryo transfer and nothing seems to help. The clinic can't get my endometrium above 4.5 millimeters. Now this is a common and sometimes very difficult problem that we see in the clinic, and it's probably true to say that there's more to the receptivity of the womb lining than thickness alone. In general, most clinics would like your womb lining to develop thicker than 7 millimeters, but this is a slightly arbitrary threshold based on old studies. Every patient is different, and for some women, the lining of their womb will never develop to this level. And when faced with this issue, it's often about making sure that we achieve the optimum level of womb lining for that individual patient, so in other words, reach their potential. It's also important to rule out any potential pathology that could stop the womb lining develop and interfere with an embryo implanting. One of the issues that we look for is something called Asherman syndrome. This is where adhesions form within the womb cavity and can inhibit the development of the womb lining. In terms of moving forward with treatment, if we've ruled out pathologies that can affect how your womb lining grows, it's often about trying to maximize the development of your own endometrium, and we can do this by altering perhaps the dose of the drugs that we're giving you or the route at which they're administered, and sometimes we would use patches or vaginal tablets, and occasionally we will simply monitor the lining of the womb in a natural ovulatory cycle. There are some interventions that really don't have a good evidence base but are commonly used in clinics, and this is not something that we would generally recommend. For example, Viagra or platelet. More recent studies don't suggest a particular threshold below which a pregnancy cannot occur, down to quite low levels or quite thin levels of endometrium at around 4 millimeters. So although more studies are needed, as long as underlying pathology is being ruled out and we feel that we've reached the maximum potential for you, it's often worth proceeding with your embryo transfer.